Hi students, welcome back. This is the first recording for Unit 8, focusing on the treatment of psychological disorders. So here are the learning objectives. We'll identify and explain the different approaches to treating psychological disorders. I'll recognize and describe different types of psychotherapy, identify and describe the biological therapies, explain the social cultural approaches and the corresponding issues in treatment, and recognize how therapy affects health and wellness. So let's start by looking at the two major approaches to the treatment of psychological disorders. The first one is a subfield within the discipline of psychology, which is clinical psychology. So this is an applied field within the discipline of psychology. So it is the area that integrates science and theory to prevent and treat psychological disorders. Okay? Then we have psychotherapy. And psychotherapy is a process that is not unique to psychology. There are psychotherapists that are practitioners from areas related to psychology, such as social work or counseling, and they can practice psychotherapy, okay, but they're not clinical psychologists, okay? So psychotherapy is the process, is a much broader process that is not unique to psychology as a discipline. It is a non-medical process that helps individuals with psychological disorders recognize and overcome their problems. So some of the strategies that all psychotherapists use include listening, interpreting, and also coming up with talking, listening, talking, interpreting, rewarding, and modeling the target behavior so that the patient can imitate that behavior in a supervised setting. Okay, so again, psychotherapy is a process, is non-medical process that is practiced by a variety of mental health practitioners, including psychologists, but it also can include counselors and social workers. There's a competency that is unique to the field of clinical psychology, which is the assessment of a clinical condition. And so for someone to be a clinical psychologist in Canada, they have to obtain a doctorate degree, so a PhD in clinical psychology, and only then will they have the designation and the licensure. So they will have a license to practice psychology. And they will also be able to, in addition to treating psychological disorders, they'll be able to assess them. So to make a formal diagnosis or assessment for any given condition. So only clinical psychologists have the credential to do that. Okay. Psychotherapists, on the other hand, can provide counseling. So they can provide counseling. They can provide mental health counseling, but they can't diagnose any given condition, okay? So let's look at some of the strategies that psychotherapists in general use to provide counseling services. So these are the strategies: talking with the client, interpreting what they're saying, listening actively, rewarding the target behaviors and the target mindset, and also modeling. So again, modeling is displaying the target behavior so that the client can learn about it by imitating it. So the client can then engage in imitating that target behavior. So now we're going to look at biological therapies. So just to give an example about modeling, though it's not something that you have to know in particular in this course, but modeling might be if a client has difficulty initiating conversations with strangers or with people, acquaintances, people that they come across in their lives, the therapist may model that behavior. So how you can initiate a conversation with someone in the library, with someone at a workplace. Okay, so provided it's in a safe setting, the modeling is happening within the counseling session, and then the therapist will just emulate that behavior, would just express that that behavior so that the client can observe and can learn through observation and then imitate it in front of the therapist. And then the therapist can give some feedback for correction. So now we're going to look at biological therapies or biomedical therapies. So these are treatments that are used to reduce or eliminate a psychological disorder by altering bodily functions. So some bodily functions are altered. And those psychotherapy and biological therapies or biomedical therapies have a common goal of alleviating or relieving the suffering of individuals who have psychological disorders. What differs is how they focus the system that they focus on. So for biologists, it's going to be hormonal, neurological, and also the types of professionals that it takes to deliver those services or those treatments. So let's look at some examples. So those who administer biological therapies are required to have completed training to become a medical doctor. So they have to be physicians. They have to have a license to practice medicine, and only they can prescribe a biological treatment, which can be some type of medication. Okay, so as we continue and we look at psychotherapy versus biological therapies, it's important to recognize that while these treatments differ, what they share is that they both aim to reduce or eliminate the psychological distress and the functional impairment that patients with clinical conditions experience. But where they differ is in their focus and also the types of professionals that are involved in delivering the services. So let's start by looking at the biological approach to therapy. So here, there's going to be, it's important to recognize that those who administer biological therapies, so these can be treatments, drug treatments that alter the person's endogenous functioning, their internal functioning. So it could be a drug treatment that alters neurochemical levels, a drug treatment that alters hormone levels. And so, or it could be a treatment like some type of a brain treatment that we're going to cover later. So those individuals are required to have completed training to become a medical doctor. So they need to have a license to practice medicine. And this is an MD, to have an MD degree, a medical degree. And so only they can prescribe pharmaceutical treatments or any other treatment that alters biological functioning. Okay, so it could be a drug that alters neurochemical levels or hormones. Now, what if a psychotherapist does deliver a service, a psychotherapy service, but then comes to recognize that perhaps the client would benefit from medication? This is when the psychotherapist would refer the client to a psychiatrist. So a psychiatrist is a medical professional, has a license in medicine, and so psychiatrists are the medical doctors who specialize in treating psychological disorders. So they can both diagnose a clinical condition and they can prescribe a medication for its treatment. Okay, so now we're going to look at psychotherapy. So again, it's a non-medical process that helps individuals with psychological disorders recognize and overcome their problems. It's a broad term that includes mental health professionals from different disciplines. So clinical psychologists can say to be practicing psychotherapy. They say that the process that they're practicing, that they're delivering to a patient, is psychotherapy. So again, clinical psychologists are those who have attained a doctorate degree in clinical psychology and can both diagnose clinical conditions and also deliver the psychotherapy treatment for them. Other mental health professionals that can practice psychotherapy are counselors. So counselors must have a minimum of a master's degree in counseling. So they have to have at least a master's degree in counseling to practice counseling. And social workers are also able to achieve a master's degree in counseling and also practice counseling. Social workers can achieve a master's degree in social work and then aim to obtain a license, enable them to practice counseling. Okay, so the first thing that these prospective professionals would do is first attain the academic credentials. So for clinical psychologists, it would be a PhD in psychology or a doctorate degree in psychology. For counselors and social workers, it would be at a minimum a master's degree in counseling or a master's degree in social work, respectively, following which they have to apply for a license. So that's when they apply to the College of Alberta Psychologists here in Alberta or to the comparable organization for counseling and that for social work here in Alberta. And then they're going to, those on the review committee are going to evaluate their credentials to see if they have the course requirements to apply for license. Okay, so if they do have the course requirements and have completed some type of a practicum where they've practiced under the supervision of a licensed therapist, then they're going to be considered for a license and they're going to receive a license. But even then, the license is provisional because they're going to receive a provisional license, meaning that they still have to practice under the supervision of a licensed practitioner. So it's very difficult to become a mental health professional, but it's feasible, and the earlier one starts, the better. And so, does psychotherapy work? The answer is a resounding yes. Multiple studies have reported that individuals who receive 12 to 14 weeks of counseling have better health outcomes that are specific to the problem that they were dealing with. They have improvement in their symptoms relative to individuals who received a placebo treatment. So that is a treatment without any active form of counseling. Okay, so it's a placebo. It's just to measure how much improvement comes from the mere belief that you're doing something that is going to improve your health. Okay, we covered the placebo treatment in the previous course. Okay, and they also do better than individuals who don't receive any counseling. Okay, so does one form of therapy work better than others? So the answer is no. There's no empirical evidence or scientific evidence that definitely prescribes that one therapy is superior to another, but rather what's important is that some therapies might be more effective than others for particular psychological disorders. And while psychologists or counselors or social workers may have a preference for one therapy over another, what's important to take into consideration is the person's individual diagnosis. So when someone presents with a problem in a clinical setting, the goal is to try to understand what are the presenting symptoms, what is the therapy that would best address those symptoms, and use that for the specific individual. Okay, because individuals who have the same clinical condition do present with varying symptoms. Okay, so it's very difficult to conclude that there's going to be one treatment that is going to be effective across all individuals because they vary in their presentation, showing the minimum symptom required to reach that diagnosis. They do share that in common, but they vary in terms of other symptoms. It's important to have an individualized approach and to see what treatment would best address the condition, what treatment would best address the symptoms that this person is presenting with. Okay, pause.